Hello, I am Dr. Vaishakhi Rustagi. I am a consultant pediatric endocrinologist practicing in Delhi. Today I am going to discuss congenital hypothyroidism with all of you. Thyroid gland is a butterfly-shaped gland which is placed in the anterior part of the neck. It produces a hormone called thyroxine, which is required for the regular development of the brain. For the first 3 years of life, it causes development of the brain. After 3 years of life, it is required for physical growth of the child. Congenital hypothyroidism is a term used when the child is not producing enough amount of the essential hormone called thyroxine. Now this could be either because the gland is absent, that is, a thyroid gland is not present at all, or it is not able to function enough to produce the thyroid hormone. As I have already discussed before, that thyroid hormone is extremely essential for the development of the brain in the first 3 years of life. If a child has congenital hypothyroidism, it needs to be treated as fast as possible. Generally, newborn babies do not have any signs of hypothyroidism at birth, so this condition can easily be missed. To get away with this, most of the developing countries have started newborn screening for the thyroid hormone. In this, either the cord blood sample is taken from the umbilical cord or a filter paper sample is taken from the baby's heel prick to diagnose congenital hypothyroidism. Thus, these babies can be picked up early and treatment can be started accordingly to avoid mental retardation in these children. Delayed treatment can cause permanent damage to the brain and mental retardation in these children. Hence, it is extremely essential to start them on treatment on time. Treatment is just in the form of a small tablet which can be either mixed in water or the mother's milk and given to the child once a day. Regular follow-up of these children under a pediatric endocrinologist is important because their dose needs to be titrated with their age and weight. If they are receiving the right amount of dose, these children develop normally and are at par with any other children. If there is a suspicion of transient congenital hypothyroidism in a child, which is also a temporary variety, on follow-up, your pediatric endocrinologist would assess the child, and at 3 years of age, we can stop the treatment and see if the child is doing well without the hormone. If it is a temporary variety, most of the times we are able to withdraw this hormone after the age of 3 years. The prognosis of congenital hypothyroidism is extremely good if the treatment is started on time. However, if there is any delay in treatment, it can cause permanent mental retardation in these children. So to summarize, the diagnosis and treatment in congenital hypothyroidism, if done on time, can prevent long-term sequelae in these children.